The menstrual cycle, or so-called menstrual cycle, is a series of changes that occur in a woman's body on a regular basis on a monthly basis to prepare the uterus for pregnancy and the formation of eggs, controlled and regulated by hormones that are affected by the body at different levels of excretion and concentration. The menstrual cycle begins in females from puberty to menopause, a woman's fertility period, during which she can give birth. The duration of the menstrual cycle ranges from 21 to 35 days, depending on several factors, the most important of which is the regularity of the menstrual cycle and the woman's age. The beginning of the menstrual cycle is the first day of the menstrual cycle bleeding blood during menstruation, which lasts from 3 to 7 days, during which the endometriosis separated from the uterine wall is eliminated and exited through the vagina in the form of bleeding blood. And the last day of the menstrual cycle is the day before the first day of menstruation flow the following month. The period of menstruation is divided into 4 stages. The menstrual phase. The peripheral phase is to get rid of the thick endometrium of the body through the vagina. The pelvic fluid consists of blood, endometrial cells, mucus. The menstrual period lasts between 3 to 7 days. The experimental phase begins on the first day of the menstrual cycle and ends in ovulation. The pituitary gland stimulates the vesicular hormone by stimulating the hypothalamus gland, which in turn stimulates the ovaries to produce about 520 vesicles that appear on the surface, embracing each immature egg vesicle. Usually only one egg matures, and the rest dies. And this happens on the 10th day of the 28-day cycle. There are many symptoms that appear in the menstrual phase, such as painful contractions, breast pain, bloating, mood swings, irritation and irritation speed, headache, tired, lower back pain. Menstrual interruption is an indicator of the end of women's fertility period and their inability to conceive thereafter. Women often stop menstruating at the age of 45 to 50. Menopausal symptoms may extend from 2 to 8 years, during which the woman feels several physical and psychological changes, including depression, hot flushes, a sudden change in the body that lasts for a few minutes and repeats during the night, are felt by the lady with her high body heat, sweating, increased heart rate, anxiety, sleep disorders, reduced libido, dry vagina, severe pain during sex dysplasia, joint pain, osteoporosis. Menstrual interruption symptoms can be alleviated using alternative hormones, lifestyle change, and consult a specialist doctor. Menstrual interruption may occur for other reasons such as hysterectomy or early menopause during the 20s. Menstruation. An absence for a period of more than 90 days may be for the following reasons: pregnancy, breastfeeding, eating disorders, severe weight loss, and its reach to a lesser extent than normal, neurological and psychological stressors, excessive exercise, receiving a specific treatment causes menstrual disorders as a result of exposure to health conditions or certain diseases. Dysmenorrhea is accompanied by the period of menstrual flow, which is a severe pain experienced by ladies during menstruation due to convulsions and contractions. Due to certain substances excreted by the body during menstruation, dysmenorrhea can be observed in adolescent girls. And dysmenorrhea is not an indicator of any disease, but when the lady is of advanced age and women with dysmenorrhea are advised to use painkillers as non-steroidal anti-inflammatory and use heating cushions to alleviate these symptoms. Abnormal uterine bleeding is vaginal bleeding that occurs in non-normal periods of menstruation and includes the following: bleeding in the intercessional period, bleeding after sex. There are blood stains in the non-menstrual time, bleeding abundance, and its extension for longer periods than the normal period of menstruation flow. Postmenopausal bleeding, menopause. Migratory endometriosis is a critical condition that causes severe pain during the period of menstrual flow and can only be treated by stopping menstruation by taking menstrual interruption medications and occurs for several reasons such as exposure to injury during surgery, some immune diseases, and developmental problems in the embryonic phase. In this case, endometriosis grows up to fallopian tubes and ovaries to cause problems when separated and menstrual flow, which causes infertility, inability to have sex, severe pain when menstruation flows, and the occurrence of uterine adhesions. Whatever the reason for any of the above-mentioned problems, the competent doctor must be reviewed for appropriate diagnosis and treatment. The absence of menstrual cycle, as a result of a hormone disorder, may lead to many problems such as the growth of uterine fibers, polyps, or even cancer, and in other cases may be indicative of the presence of polycystic ovaries.